Hello everyone, Dr. Colin Bartoe here again with the Functional Neurology Chiropractic Center. And today we're talking about how concussions happen. Most of us will often think about concussions as related to a sports injury. Thinking about the football player that gets tackled really hard and now they're nauseous and dizzy, or maybe they vomited on the field. Or the MMA fighter, boxer, or other combatant that gets knocked out in the ring. And these can definitely cause concussions, but in reality, concussions can happen in a very wide range of different types of injuries. And today I wanted to take a look at some of these. One of the most common types of concussions that we see in our office here is related to car accidents. Now, when we're talking about concussion, it's important to understand that not only does an impact directly to the head have the potential for causing a concussion, but a whiplash motion can also cause a concussion. As that head moves and whips, the movement of the brain inside the skull can injure the brain and cause concussion symptoms. In these car accident types of situations, even a small impact, a fender bender, if you will, can cause a concussion. And it's very, very common that we see patients that have been involved in a car accident that have headaches, brain fog, dizziness, nausea, and other types of brain-related problems after a car accident. And there are a number of chiropractors that trust us to send their patients over to us so we can collaborate and work with those offices to help make sure that their car accident patients are getting the best possible care and recovery that they can. Other types of concussions can happen in all sorts of different ways. We've had a patient that leaned into their trunk, and when they came back out with what they were grabbing for, they ended up smacking the back of their head on the bottom of the trunk lid and gave themselves a concussion. I had one patient that was a trainer, an athletic trainer, and when they were lifting weights, they were doing what's called a snatch. So they lifted the barbell from the ground up overhead. Well, they headbutted the bar and gave themselves a concussion. Something as simple as laughing too hard with your friends and throwing your head back and smacking it against the wall can create concussion type symptoms. And of course, roughhousing with your brothers or your siblings or your friends, kids, this happens quite a bit. Getting whacked in the head accidentally can cause concussions. And so it's important to understand that if somebody hits their head or has an injury, and now all of a sudden they're having headaches, eye pain, brain fog, brain fatigue, eye fatigue, having emotional disturbances, like maybe they just don't care about things anymore, or maybe they're very irritable, or they're having outbursts of rage or aggression. Any of these types of things can really give us an idea that there might be a concussion going on. And so it's very, very important that we take the time to talk to our doctors, find a concussion specialist or somebody that does functional neurology in your area, and really work to figure out if that injury is a concussion, if it needs to be treated, and get that person back to full health. There's a lot of different people out there that need this type of care and really don't know. So our mission here at the FNCC is to create a greater level of understanding about concussion and let people know that there is hope. If you like the information you saw today, if you like the information that you've seen on our channel, please like this video, subscribe to our channel, shoot us some messages or leave messages in the comments, ask us questions, and we are happy to share, we are happy to educate, and we hope to see you again soon. Have a grateful day.